Evening's presentation is the COVID-19 remobilization of the membership, and it's an operational plan brief for our wing commanders and staff. First off, we'll get things moved over to General Smith for his commander's intent. General Smith?
Yeah, thanks, Moose, and good evening, everybody. Good afternoon for those of you who are further out west. Appreciate you being on the call this evening. I must admit that I'm pleased that we're finally at the stage to where we can begin talking about remobilization, about slowly moving from the current set of restrictions that we're in to something a little bit less. And I'm also pleased with the thoughtful process that's been put into place by really an amazing team of subject matter experts. And you're going to be hearing from some of them here in a little bit. But it's very careful, it's very methodical as we focus on the well-being of our people and slowly moving forward from the current set of restrictions. We'll hear from them in about the particulars in a moment, but in general, responsibility is being pushed from me down to the wing level for developing wing level recovery plans, because wing commanders and those of you who are members of the wing teams who are going to be helping your commanders, you're closer to what's going on. You're the boots on the ground for what's happening within your particular state. There's no one size fits all that I can roll out that's going to make sense for a South Dakota or a Maryland or a California or a Florida all at the same time. And so that's where we're relying on the wings for developing these particular plans. The review and the approval of the plans is going to be done at the national level by this team of experts, and it's led by our National Vice Commander, General Felka. Now, there's one thing that I wanted to stress with you as we go through all this. It's imperative that we stay true to the guidelines that have been sent out to you, that we're going to be talking about tonight, that you're going to study in greater detail as you develop your plans, because we need to focus on the well-being of our people. It would be really nice to just throw the restrictions out the window and get on with life, but that would not be wise from a position of safeguarding our people. So we really need to stick to the guidelines that are laid out for you for gradually going from phase 0 where we are now up to phase 1, ultimately 2 and 3 when it's appropriate for your particular geographic area. Now we're going to focus on the well-being of our people, and then to the best of our ability, we will balance that with the mission readiness and mission accomplishment. What you've been doing so far in accomplishing all the missions that have come your direction is really amazing. Other missions haven't started, or I'm sorry, haven't stopped during all this. We've had hurricanes, we've had floods, and there's tropical storms out there in the Atlantic, in the Caribbean, that folks are looking at what the hurricane season might look like. So we're all interested in preparing ourselves for executing these other missions as well. But number one imperative is taking care of yourself, taking care of your folks under your purview as well. And then we will work into the equation in a graduated manner, being able to prepare ourselves for going out and executing other missions outside of COVID-19. So that's it from me. Let me go ahead and hand it off to the national team lead for our remobilization, General Felka. Thank you very much.
Thank you, General Smith. It's a privilege to be able to lead this team, which I'd like to emphasize is a true cross-functional team that's made up of highly qualified subject matter experts from our health services section, from safety, and from operations. It's CAP volunteers as well as CAP paid staff. So it's a true cross-functional team. We're one team and we're working together to ensure that CAP is progressing forward in a careful, methodical way. We're making data-driven decisions in the process of methodically opening CAP. The process is designed to be methodical and deliberate. It's not hurried, it's not rushed, it's very careful. Wing commanders are empowered to utilize their staffs to create wing-specific plans based on data and scientific recommendations, balancing mission readiness and members' safety, just as General Smith was talking about a few minutes ago. Plans will be carefully reviewed by this national team, so we ask for patience since there will likely be a surge of plans as wings begin to enter phase 1 criteria. At this point, I'd like to introduce Lieutenant Colonel Tom Janisco, the Senior Program Manager for Health Services for Civil Air Patrol, with my personal thanks to him and the entire team for the outstanding work that has been done so far on this very important project. Tom?
Thank you, sir. So first and foremost, leaders and staff, good day. Thank you for taking the time to be part of this brief and remobilize the force. The intent of this process has been to safely and carefully use metrics and data to remobilize the force. Next slide, slide 5.
It's up, Tom.
Thank you. So this is your support team that can help you with creating your plan. This is also the group that's going to review the plan. So if any questions, please contact us at covid-19plans@capnhq.gov or individually if you have any command, ops, or health service specific questions. So again, covid-19plans@capnhq.gov if you want the group, or specifically to each member if you need a specific command, operations, or health services specific question. Next slide, slide 6. So bottom line is that CAP is using the White House phasing plan to transition back to full operating capacity because it's a deliberate and careful process. So the White House phases use the following metrics. Number 1, a 14-day downward trajectory in both influenza and COVID-19-like illnesses or suspected cases, a 14-day downward trajectory of confirmed cases, and then 3, having both hospital capacity or beds in the hospital, sufficient treatment, so enough providers, and then robust COVID-19 testing capacity for workers. So those 3 things are required to go between phases. As an example, going from phase 0 to phase 1, you would need to meet those requirements. Moving on to the next slide, slide 7. So to assess the state or wing's reopening risk, we're going to use covidactnow.org, which is going to provide you with a map, and that's going to provide a general metric for the White House phasing by assessing the data through, it's really a team of epidemiologists and health experts, and it provides really the best data-driven source that we know of to provide a general reassessment risk. Moving on to slide 8. So in order, you're going to go to covidactnow.org, and that's going to present you with that red, yellow, and green color-coded reopening risk map. When you look at that map within your state, a general rule of thumb would be, hey, if your state's green, prepare for that CAP reopening within on or about 15 days, yellow, on or about 45 days, and then red, on or about 75 days. Again, plus or minus, those are good planning factors. We're going to go to slide 9. So here we're going to use Texas as an example. It's going to identify, again, the current, and I want to underscore current, not future, but current data. In order, it's going to give you the infection growth rate, positive test rate, the ability for a hospital to surge, which they're calling ICU or intensive care unit headroom, and then it's also going to show you a state hotspot map. So to be green, you need a growth rate of less than 1%, a testing rate of less than 3% positive, and a ICU headspace or bed space of at least 50%. Lastly, you see the state hotspot map. that could be used if you see, for instance, Texas is a large state, and if you had all your units on the west side of Texas, that could be used again for some planning processes. Move on to slide 9. Excuse me, slide 10. So you're going to routinely reassess your state's opening risk by going to the COVID Act Now website. If the metrics remain green for 14 days, you can move to the next phase, again, unless that state is more restrictive. So that's a really good and underscored piece here. So down at the graphics at the bottom, infection growth rate is green on the left. In the middle, the positive test rate is green. And then on the ICU headroom, again, on the right side, it's green. So for that state, they would be in the green. If they do that for 14 days, they would then move on to that next phase. Slide 11. So here, because COVID is expected to wax and wane, there may be some reemergence next fall. It's really critical to review the data pretty routinely. So making sure that all of your data points are staying in the green and driving toward the green side. If they fall into the yellow, again, making sure your unit commanders know that and doing a quick pause with your reopening plan. We're going to move on to slide 12. So currently we're in phase 0, which is really essential missions, only being performed by those that are low risk, who are socially distancing, wearing cloth face coverings, keeping our minimal staffing. And the low risk, by the way, is according to the CDC. So the CDC has a great webpage and defines COVID-19 low risk and high risk categories. We're going to make sure that our members, when they say, let's say we have a essential mission that's coming in, and we're going to make sure our members are well. We're going to have them either do a temperature check at their home and say, yeah, they don't have a temperature, or when they come to the, let's say, the unit for an essential mission, we're going to take their temperature. We may also ask them some questions about their symptoms, like, hey, are you feeling well today? So we're going to do some level of proactive ensuring that our membership is well. And then if this was aviation specific, make sure our crews wearing face masks, potentially putting on some aviation gloves, and certainly disinfecting between sorties. And also just underscoring that only essential missions. And then for the strategy here, making sure that we're employing the full public health protection measures. Hygiene education, hand sanitizers available, making sure we're doing routine hand washing breaks, some cleaning of workspaces, wearing of those cloth face coverings, doing that social distancing, temperature checks, either at the unit or at the person's home, and then asking members if they feel well before entering a mission. Moving on to slide 13. Now we've transitioned to phase 1. So we've had 14 days of green. Now we can bring in some members. Again, those are going to be low risk members in accordance with the CDC. The number of members is going to be less than or equal 10 people. Again, low risk category, they're going to come to meetings, socially distanced, wearing those cloth face coverings, good hand hygiene, good common surface hygiene, doing those health status checks through questions, and those temperature checks, either at home or at the unit. For aviation, pretty similar, face coverings, aviation gloves, doing some disinfection between sorties. However, we can include some flight evaluations, some check rides, making sure some crew proficiency occurs, and then some dual instruction, assuming that all members for that dual instruction are low risk and all flight ops are low risk areas. Still going to do those full public health protection measures, hygiene education, etc. Slide 14, we're going to move into phase 2. Instead of 10 members, now we can bring in up to 50 members. They're still going to be low risk. We could come into a day-long activity, still going to do that social distance, making sure we still do those public health protection measures like hygiene education, social distancing, temperature checks, face coverings, and that common surface cleaning. We're going to make sure that our high-risk members continue to telework, and that's a really important piece here. So we've got a group together, 50 people. We're going to make sure that they're distanced well. but we still want to make sure our high-risk members are still teleworking. For aviation, still face coverings, aviation gloves, air crew disinfection between sorties. Now we're going to include some small group local flight crew training, flight evaluation, check rides, some crew proficiency, dual instruction of CAP cadet orientation flights. And again, that is the same, assuming all members are low risk and all flights are in low risk areas. Move on to slide 15. Okay, so we have had an additional 14 days of in the green. We've gone from phase 2 to phase 3, and now we can intermittently bring in some high risk members. So we have our high risk membership, then would be an example like age greater than 65. Maybe someone has a chronic disease that is not well controlled, like maybe diabetes or maybe kidney failure. They're going to gradually return to that intermittent unit activity or mission duty, but we're going to continue to do that social distancing. We also want to make sure all of our members stay away from crowds. And then for aviation, similar aviation gloves. We're going to disinfect between sorties. We're going to make sure that our low risk and high risk members, if the high risk members are present, are wearing face coverings. We're going to add in our top flights, external orientation customers, and potentially some flight academies. For our public health protection measures, pretty similar, common surface cleaning. We're going to do some good public health education, social distancing, hand hygiene, and really want to make sure that we logistically prepare for any further COVID or influenza for that matter. Move on to slide 16. So this is a strategic graphic. On the left, you're in phase 0. On the right, you're in phase 3. And please note that this is going to be a tug of war potentially, right? So that we won't necessarily go always from the left phase 0 over to phase 3 on the right. We'll be going left to right and right to left. So just note that. It won't necessarily be a linear process. We're going to move on to slide 17. So this is the public health protection measures by White House phase. So this graphic shows the White House phases that correspond to the public health protection measures. As always, deviation can be appropriate and used by a commander, but note that these are also the DoD recommendations. So while a commander can do deviation, just know that this is the same playbook, if you will, that DoD is using. An important part about the face coverings at phase 3 is that, as a reminder, that's when our high risk groups come back, and we, the lower risk groups, really want to make sure we're taking care of our higher risk groups by continuing that social distancing and really using those cloth face coverings to provide a level of protection for them. So the bottom line, protect the membership, reduce the risk, take care of your team. If you have any questions, please contact the group or myself. Any questions, thank you very much.
Moose, are you muted?
Thank you, sir. We've actually put together a lot of tools for the members, and we wanted to try to consolidate the remobilization effort. So we've established a website just for that. And you'll see it up here. It's actually linked on the main information center as well, and under the operations section. But we've put together several materials for you that we want to just highlight for you here this evening. On the website, you'll find that we've posted frequently asked questions, as well as the narrated briefing that we sent out here yesterday. You'll also have updated briefing handouts and such, and we'll step through a few of these right now. First, you've got the checklist here. This is just the phase 1 checklist. This checklist is meant to be a starting point for you. That a lot of the wings will want to make adjustments and potentially add content to this. We'd recommend you follow the checklist, but obviously, if there are suggestions, we're more than willing to take them and try to improve this for everybody, because not every wing will be going through all the steps at the same time. Some wings will be starting right away, others there'll be a delay. So please send us your ideas as you're looking at the checklist. We've also established template plans. We've tried to make this hopefully as easy as possible, but there's definitely going to be some variation across the wings. Our planning team will be reviewing and approving the plans from across the country, and it would be easiest, obviously, if everybody's using the template. But we know there's going to be some reasons for variation that definitely want you to consider that. First, on every plan, we'll want you to identify who your point of contact is for the wing. It's probably not going to be the wing commander, and it will probably be somebody designated by the commander to try to coordinate all of the efforts. But this way, the team knows who to contact as we get plans submitted to us. We know who to reach out to try to address any questions that we may have. And then you'll find that the checklist is actually oriented to follow the checklist. The plan is actually laid out the same way with the same paragraph, so they match up between each other. But we want you to identify who the OPR is assigned within the wing, what your dates are, and any notes that you may have as you're pushing forward. We want to try to make sure that you have a tool that can be useful throughout the process. And make sure that we can actually help you as you go. And then you'll see it follows the same pattern going through. And we also added blocks at the end if you have additional tasks. You can obviously adjust these. Now, you don't have to follow the template, but I will tell you that it will be harder for us to review plans since we have to review 52 plans times 3 with each phase. So that as you go through, we want to make sure that it's as easy as possible. So we'd suggest you follow it. But if you have ideas or suggestions, just reach out to us. Maybe something we can add for everybody and try to address overall. Now, that's the main content of the site. We wanted to take a few minutes. I know we've been answering some of the questions throughout the presentation here, but if there are any questions, now's the time that you can submit them into the Q&A, and we'll try to address more of them as we go. The first one here, Tom, is something you might want to address. It's the criteria to be required to move back into a phase if you've been moved back and forth. In some cases, we're going to have wings that may run into challenges, those sorts of things. So, how do you suggest that we address that, Tom?
Thanks, John. So I think that it is a nuanced question with a nuanced answer. I think if a wing is in the green and then briefly goes into a yellow and then goes back in the green, well, things are moving in the right direction. However, if a wing is in the green and then goes into yellow and it is believed that will stay in the yellow, then I think that's a good point to take a knee, have the wing command reach out to the COVID-19 group, and we can come up with a iterative process of making sure that we're taking care of the membership, but also making sure that you guys are able to complete your missions.
So bottom line, that we really want you to communicate with the planning team for this. If you run into see things regressing, or if you're having concerns, reach out to us and we'll work with you to try to address any challenges. Let's see. So an interesting question. The general focus, they kind of answered this: who takes the lead on transitioning between phases? Is it the wing commanders? Can they delegate it to the ES directors? And we fully encourage the wing commanders to use their staff. The wing commander is responsible for the plan, for getting it submitted. They designate who the POC is. But we did not specify a specific officer within the wing that's responsible, because the different wings have different things happening right now. heading into the summer, a lot of times your cadet programs, cadet staff members may be very critical just because of a lot of encampments and cadet activities that are scheduled. So they may be a key person to deal with on the plan. There's lots of potential within this. So we've also got questions about if your state is not complying with the White House plan, how do you move forward? Well, generally for us, we're following the federal guidance unless the state is more restrictive. So we're going to want to take a careful approach and be conservative in moving forward. But that's generally how we will work it. Now, our challenge obviously is this is a long game. This is not something that we'll be doing just over the next couple of days. This is over the next weeks and months in reality. So we want to take our time and answer the right questions and take care of our members. Let me scroll back through some of the other ones here that we might have had. So are the transitions between days based on 14 consecutive days or cumulative? Now, Dr. Layton's answered this already. We're really looking at a general trend, but we know that there's going to be some waxing and waning of the numbers. In some cases, as things open up, you expect some of the numbers to not trend the way you want them to. But we're looking over that 2-week period to see overall, are the numbers trending in the right direction? And we'll work with you to address any concerns. We had a question about what is a definition of a high-risk member. Tom, can you summarize that? And we can refer them. There's actually some definitions in the FAQ, but can you summarize what you would consider a high-risk member? You still there, Tom?
Hey, sorry about that. I was wrestling with a mute button. So CDC states that high-risk members, and I'm going to say high-risk group, people that are 65 years of age or older. I'm going to say people who live in a nursing home or long-term care facility, just for completeness, and then people really at any age with an underlying health condition, if it's not well controlled, and they're saying including but not limited to people with chronic lung disease or moderate to severe asthma, people who have serious heart conditions, people who have compromised immune systems, and that could be someone who's undergoing cancer treatment, someone who has bone marrow or organ transplantation, someone who's a smoker is considered immunocompromised, a person with a specific immune deficiency, someone with poorly controlled HIV or AIDS, someone who uses steroids, like a corticosteroid, because that weakens the immune system. People who use immune weakening medications, sometimes for psoriasis. People with severe obesity, they're using a body mass index of 40 or higher. People with poorly controlled diabetes, people with poorly controlled chronic kidney disease who are undergoing dialysis, and people with liver disease. It's not necessarily an all-inclusive list. If you go to the CDC website to their COVID page, it'll be under people who need extra precautions and who are high risk.
Okay. Thank you, Tom. We had another question posted anonymously. Will we be able to do outside training like urban direction finding training, small UAS training in phase 0 or phase 1? Phase 0, probably not so much here. Though phase 1 is that it starts, so you'll be able to do some one-on-one type training for individual members. We address the aviation side of things, but the expectation is yes, generally the one-on-one type training that would be able to start in phase 1 at the local level. The concern would be that bringing large groups together. So we know in some cases, that may be difficult with some of the new programs like small UAS. You may, because there's not a lot of assets to train with across the wing, that may be hard to do. But within the local area, that should not be too much of a challenge. As we move into the later phases, phase 2, definitely you can do groups of 50 or less. That would not be a problem at all. But during phase 1, generally you want to be looking at local training that can be accomplished in small groups. And phase 1 is also the time where you're probably going to be getting staff together and looking at cleaning facilities and doing all those sorts of things to make things ready for the next event. Just trying to press ahead. Scroll through here and see if we've got any others that we want to try to address here. Yeah, here's a common one that we're getting, that you must still comply with state rules, correct? Yes. We're erring on the side of caution, so whichever is more restrictive, obviously you're going to want to follow. That's the basic guidance. So if your state's got still under stay-at-home orders, then you need to follow that and make sure that your members understand that. We're still going to be responding to our emergency missions and such, and generally we've had no problems with our personnel executing those as they've popped up for tornadoes and storms and such here. But we don't want to put our members at risk either. So that while there's still stay-at-home orders in place in some places, we need to follow them, unless it's absolutely necessary to meet our mission stuff and still work with local agencies to make that happen. Okay, let's see. As we move into hurricane season, we're still in phase 0 or 1, we'll be able to seek waivers to operate. We're actually working with the commanders to address that already with Mid-Atlantic and Southeast region specifically, because there's already some potential for storms. So there'll actually be some guidance worked in the coming days for both of those regions to address that. And obviously there are going to be concerns in other areas as well that we'll try to work that accordingly. We've also had questions about large wings, and then some areas are red and other areas they're green, and breaking it down. As part of your plans, that you don't necessarily have to do them all at the wing level. For the large wings, you may want to consider doing them at the group level, or looking at limiting certain areas that may be hot spots, for lack of a better term. That's perfectly fine. But just understand that adds to the complexity of your planning and for your overall management of your wing as well. And you'll have to consider things like the members participating from those areas that are in the red versus those in the green. And how do you protect your members? So hopefully we can address that, but before you put pen to paper on that, I would suggest you send ideas to us, and we can talk with you individually as far as that plan goes and try to help you. We've also had some questions when we look at frequently asked questions for our personnel as to whether if you have a wing that's in the red, but it's mainly because of one city, especially like some of the Midwestern states where it's the state capital or one major city, but then all of our units in many cases and personnel are in outlying areas, and it's really not a problem for them. You still have to address those situations, but there are in many cases times that you can start pressing ahead. The map is a guide. Obviously we're kind of expecting everybody that's in the green is going to want to step forward sooner. But in some cases, your state may actually have better local data that may help you to press ahead. And we're more than willing to work with you and listen to those things and to review it and make sure that you're stepping out appropriately. But we want to see wings actually move back in operation. So we're hoping that you can do the day-to-day work and help you to do that. All right, I'm looking to see if I've missed any questions here, team. Are there any others that we need to try to address here? Let's see, Nate. No, do wings? Nate, are we going to post the wings plans? We might be able to glean information from them. We hadn't. They planned on doing that, but we were planning on adjusting some of the central plans. Be honest with you, we've got a lot of coordination issues already with 52 wings plans to work this. But we will be trying to get things posted for that. I've had some questions about, is there going to be a tool for tracking status to log stats and chart the data? In terms of knowing which wings are at what level, we can probably post a map to show that across the country. But as far as individual units and such, that would probably be something that would need to be done at the local level for to meet your specific needs. Let's see. There's also some questions on the testing metrics, Tom, and questions, in some cases, obviously, that some of those can be anomalous. Do you want to speak to, obviously, when we even ourselves have concerns on some of the ideas that push forward into the green. What do you think in terms of wings that are, borderline, the wings that are in the yellow right now?
Yeah, I really think that while the goal is green, if you're, let's say, consistently in the yellow and you can account for it and mitigate that risk, we are happy to review that plan, provide input, and send you on your way. The intent behind the positive test rate of 3% or less was that they want to have lots of testing and lots of negative tests. So they have obviously sufficient number of tests, and out of that sufficient number of tests, you're getting a very low number, 3% or less, of positive tests, meaning that across the community, the number of positive tests within that location is low.
Okay. We've also got some folks that mentioned that in some cases they have states that have stay-at-home orders, but counties and municipalities are creating their own orders. That's going to be a challenge. Either way, your wing is going to have to try to look at the day-to-day activities within it and try to address it on a case-by-case basis. And we'll work with you to try to help with that. But bottom line, you're going to have to work to be compliant with your state's orders either way. So if your counties are being more restrictive, you're going to have to make sure that your personnel are still compliant with your counties as well as your state orders. So we understand it's complex, but we don't have a get out of jail free card. Let's see here. They had an issue about instrument currency being an issue brought up by pilots. Not having a safety pilot on board can be problematic. We're actually allowing for dual instruction as well as the proficiency starting in phase 1, so that would really be something that would be opened up anyway. And we actually don't require a lot of instrument flying across the country day to day. Now, some missions do, and I believe this was from a wing that's doing some of our air defense missions that happen in the middle of the night in some cases. So I would not be surprised if they need more instrument personnel. If you've got a critical missions like that, though, right now, you can actually do some of the training for those to actually get people prepared for missions. Now, that doesn't mean that you just jump out. Please reach out to our planning team staff, and we can work with you to make sure that you're addressing it smartly. But if you've got a real-world mission that you're going to be supporting that you need to have people prepared for, we will work with you to make sure that you can answer them. Okay. Let me just scroll through here and see if there are any others that we need to try to address. Just the general commentary, as far as the reporting for the GIS survey, that has been very helpful for us across the country. So we would please encourage you to still continue the reporting in the GIS survey, and at least for the next few weeks. That is actually helping us gauge where we've had troubles across the country, and also look at our general population, which has been helpful. There's also an idea about customizing plans a little per wing, and that's perfectly understandable. We do understand there's going to be some need for customization. That's why we provided a template. but we do expect some variation. So we can definitely work with you on that. And there's the example that was given was could we open up some flight training for father-daughter members that live together? Parent and spouse, that's something that as you move into phase 1 here, that wouldn't be an issue either way for under dual instruction. But part of the deal with being at phase 0 is also trying to make sure that we're addressing the bigger picture as well. And even though those members may be safe themselves, who are they also going to encounter at the airport, those sorts of things. We want to make sure that our members are actually protected overall, because we don't only have a responsibility to make sure that they're safe in their flying, but overall, if they're participating in CAP activities, we want them to be safe in general and be taken care of. Okay. We've got a question about if an external agency has requested CAP participation in a training exercise run by that agency, where would you fall vis-a-vis essential missions? Well, training's not necessarily essential. We will work with you, obviously, but in some cases, it may be that you have to look at which phase that you're in and just be honest. I will tell you that we've seen a lot of exercises that were on the calendar that have been pushed back or canceled and such. It really all depends on what's happening in the locality. We'll address that case by case as those exercises come up. We don't want you to ruin your relationships, but at the same time, we do want to make sure that that we are being safe as we do it. And it may mean that we have a modified participation. It may be smaller participation than normal, or it may be that we have groups participating from their home locations rather than gathering everybody at one central location to participate if you're in phase 1. So it just all depends on what's happening within the wing and what's being asked of you. All right, for our team reviewing everything, I think we've tried to address most of the questions as we've gone through here, and try to make sure everybody's prepared. If we have not, we will look at these afterwards and try to post some of the questions that we didn't have beforehand in the frequently asked questions on the main website. I just want to give a quick round out to the rest of our team here. Just to make sure, General Smith, do you have anything else that you'd like to say to the group here?
I'll just say thanks in advance for the hard work. It's going to, it'll be challenging, no doubt about it. And as Tom Janisko was talking about, it's not necessarily going to be linear. There's states are going to see advances and setbacks just based on what's happening with infection rates. So expect that. Please follow the guidance that we've set out there. As Tom and Moose have both said, give us your inputs on how to make this even better. My compliments, Moose and General Felka. You and your team are rock stars, and I appreciate the work. So that's it, Moose. Thank you.
Thank you, sir. I appreciate that. And thank you for the entire team helping us here. And thank you for all the participants. We've got 207 attendees on this right now. And I know we've had some people that pop in and out. We really appreciate everybody taking the time here. This recording that will actually get posted sometime tomorrow. We'll have to convert it before it gets posted. But we will get it posted for everybody, as well as the updated slides, because they were a little bit different than the ones the other day, because we did try to answer some of the questions that we had gotten in up front. I would encourage everybody to please take a look at the website, look at the plans. If you have suggestions or questions, please reach out to our team. That's what we're here for. And we will do our best to try to address your questions. But we would ask that you please be understanding, because it is a small team. You saw the slide there with all of us, and there's a lot of wings that are going to be working on plans here. So we will let you know when we get the response, or when we get your message, then let you know that we're working it. But please understand, that we're not going to be able to turn a plan in just a couple of minutes. So we need a little bit of time to review these, but time is our friend for this. So thank you for taking time with us here tonight. And we look forward to working with you as we move forward. So thank you everybody for participating.